Hello, and welcome to another episode of Medicated Matters. With children going back to school, I wanted to focus on ADHD in children. ADHD stands for Attention Deficit/Hyperactivity Disorder. That's a long name, but it just means that some people's brains work a little differently. There are three types of ADHD: inattentive, hyperactive impulsive, and combined. Inattentive type is formerly known as ADD. Kids may find it hard to focus or pay attention and get easily distracted. They are often forgetful, have trouble following instructions or finishing tasks, and they may seem like they're not listening even when spoken to. Inattentive type is often seen in children who are quiet or daydreamy. It can be easily missed because it doesn't always include hyperactivity. The second type is hyperactive impulsive. Children can be observed fidgeting a lot or having difficulty staying still. They may talk a lot and interrupt others, act without thinking, have trouble waiting their turn, and have trouble sitting still. This type usually gets noticed earlier because the behaviors are more noticeable. Lastly is combined type, which is a mix of both inattentive and hyperactive impulsive symptoms. This is the most commonly diagnosed form of ADHD. Symptoms tend to appear before the age of 12 and must be present for 6 or more months. Symptoms have to be in 2 or more settings, typically home and school, with significant interference with daily life. Sometimes you hear of people growing out of ADHD. This is a common misconception because as people age, symptoms become less noticeable, but the condition is still present. People who suffer from ADHD may learn more coping skills and strategies as they grow older, and they may have a more supportive environment. Roughly 80% of children with ADHD will have symptoms into adolescence and adulthood. It's important to stress that ADHD is not bad or wrong. It just means that a person's brain likes to go fast and explore lots of things at once. Some tend to be super creative, full of ideas, or notice things that others don't. And guess what? There's nothing wrong with them. It is important to practice positive reinforcement because it is an effective strategy for ADHD. Grown-ups like teachers, doctors, and parents can help with tools, tricks, and maybe even medicine to make things a little easier. In our next segment, we will go over the common treatments for ADHD. Remember, ADHD doesn't make children less smart. It just means their brain works in its own awesome way. If you like this video, please like and subscribe. Thank you. Hello, and welcome to another edition of Medicated Matters. Last time we talked about attention deficit hyperactivity disorder, also known as ADHD, and how it may impact children or even ourselves. Remember, ADHD isn't about laziness. It's your brain wired differently, and here's how to treat it. First, medication. Like stimulants such as methylphenidate or amphetamines can boost brain chemicals that help with attention. The most common form are capsules and tablets, but did you know they also have types that dissolve under the tongue, come as a liquid, and even can be worn as a patch? There are roughly 20 different forms of medication that can fit one's needs for treatment. It is best to talk with your healthcare provider about which form is best for you. For example, many prefer a once daily, otherwise known as long-acting stimulant, so they do not have to take a dose in the early afternoon. This is especially helpful for children who may feel embarrassed going to the nurse at school for their afternoon dose, or easily forgetting to take the medication at work as an adult. Non-stimulants are also an option if stimulants aren't a good fit, but today we're focusing on the stimulants as they are the preferred treatment option. Some of the most common side effects one may experience are decreased appetite, weight loss, trouble sleeping, stomach aches, nausea, headaches, dry mouth, increased heart rate or blood pressure, and nervousness or feeling jittery. Like most things mental health, there's also a therapy aspect to treatment. The main ones are cognitive behavioral therapy. This helps break negative thought patterns, tackle procrastination, and build problem-solving skills. Parent training teaches parents proven tools like positive reinforcement, clear rules, and consistent routines. Classroom interventions, things like visual reminders, breaking tasks into steps, and reward systems to keep students engaged. Organizational skills training, planning, time management, and prioritizing tasks for daily success. Lastly, social skills training, building better communication, empathy, and self-control. Lifestyle changes are also important, such as exercise, good sleep, and structured daily habits. As you can see, there are many treatment options to help treat ADHD. It is recommended to speak with your doctor on what the best treatment options are for you. In closing, ADHD doesn't hold you back. It just means you need the right tools to move forward. Please consider following our channel to continue on our mental health journey. Thank you.